Maas, Keezhapavoor.
Welcome to Maas Keezhapavoor channel. I am Dr. Aruna Shanmugavel. Let us see a motivational quote. Sometimes you feel tired of your situation, but always remember that's not permanent. Don't lose hope. In this video, we are going to learn about the muscle Buccinator. The Buccinator is otherwise called as Bugler's muscle or trumpeter's muscle or whistling muscle. It is a muscle of cheek. The outer surface of Buccinator is covered by buccopharyngeal fascia and its inner surface is lined by a mucous membrane. It is pierced by parotid duct. The pterygomandibular raphe separates it from superior constrictor of pharynx. The Buccinator muscle arises from the outer surface of the alveolar process of maxilla opposite to the three molar teeth. Pterygomaxillary raphe, which extends from pterygoid hamulus to maxillary tuberosity. Pterygomandibular raphe that extends from pterygoid hamulus to the mandible behind the third molar, and outer surface of the alveolar process of mandible opposite to the three molar teeth. The fibers are arranged into upper, intermediate, and lower groups and run towards the mouth, fill the gap between upper and lower jaws. After reaching near the angle of mouth, the upper fibers pass into the upper lip, lower fibers pass into the lower lip, intermediate fibers decussate, and hence the upper fibers of this group reach lower lip and lower fibers reach upper lip. The decussating point near the angle of mouth is called modiolus. Buccinator is developed from second pharyngeal arch and hence the buccal branches of facial nerve innervates Buccinator muscle. The buccal branch of maxillary artery and the anterior facial vein are the vascular supply to the Buccinator muscle. Lymphatic drainage is by the submandibular group of lymph nodes. The action of Buccinator muscle, what is it? Buccinator maintains the tightness of the cheeks and presses them against the teeth during chewing. It flattens the cheek against the gum and teeth and thus prevents the accumulation of food in the vestibule of mouth during mastication. It is responsible for blowing the cheek and expelling the air between the lips from inflated vestibule as in blowing the trumpet. That's why this muscle is called as trumpeter's muscle. Let us see the clinical features of Buccinator. The upper motor neuron facial nerve injury leads to contralateral paralysis of the Buccinator muscle. The lower motor neuron facial nerve injury leads to ipsilateral paralysis of Buccinator muscle. The signs and symptoms of this condition are not able to blow the cheeks, dribbling of food particles, and drooling of saliva. The pulsation of facial artery can be felt just lateral to the modiolus. The inadvertent damage of modiolus during plastic surgery leads to facial asymmetry. Let us end the session with a quote. Don't forget, you are the hero of your own story. Thank you for watching.
If you like this video, don't forget to subscribe and click the bell icon, select all to get instant notification.